Hi, I'm Dr. Lucietto, and I'm back to talk to you guys about, drumroll, weight management, a very popular topic in recent times. Something that I think it's important for patients to understand is that whether or not your insurance covers the medications is really dependent on your healthcare plan. All right. We have a number of medicines that can be used for different reasons to help you actively manage your weight and get weight off. There are some that are more effective than others, but everything has a side effect. Everything. And it depends on whether or not you can tolerate those side effects. Those side effects also, if they occur, will determine how long you can stay on the medication. But it's an interaction between you and the person that you seek health care from. So let's go. There have been some medications that have become very popular in the last few years. All right. They are very, very effective. They are medications that are in the GLP-1 category. Now, I will tell you the brand names include Saxenda, and I'm so proud of myself that I said that right. I had a real hard time when it first came out to say that correctly. Kind of turned into the Saxenda. So I work on Saxenda. Sax. S-A-X. Not the other one. But I have to admit, my patients have remembered that name because I could never say that word right. That is actually related to a medication called Victoza, which was originally used and still is used for diabetic management. There's a number of different types of diabetes. Right now, we have kind of classified 2 types of diabetes, but we have more information coming at you in the future because there's been a lot of research about different types of diabetes. And I believe we're at the point where we might be settling out at around 5, but we'll get back to that another time. The medications that are available are the injectables. All right. One is this liraglutide or Saxenda, which you would take every day. It is effective. All right. But it's not as effective as some of the newer ones. There's Ozempic, which came out, which is semaglutide, and then tirzepatide, which is called Mounjaro. Those drugs themselves are the ones that are used for diabetes and diabetic management. The exact same drug is in the form of Wegovy and Zepbound. Now, Wegovy is a GLP-1 and Mounjaro or Zepbound, which they're the exact same drug, that is a GLP-1 and a GIP. So the Mounjaro and Zepbound have got a little more to them, but you can have very similar effects from those 2 drugs. When they first came out, I was a little reticent to use them because I tried to read about these drugs before I prescribed them. And I tried to become familiar with the side effects. Probably the most common side effect is the GI upset, the gastrointestinal distress. I think it's kind of multifactorial, just from my own experience with my patients, because the drug itself kind of slows the gut down, all right? And that will contribute to the constipation and the nausea. But I think part of it is that you're not eating as much. And I don't think people understand how much fluid is actually in your food. So you don't eat as much, but you're not compensating by drinking enough. So you really need to keep your fluid intake up and increase it to a degree. Now, when you are taking those drugs, you probably are a little nauseated by anything that has a taste, anything that has a strong flavor. Doesn't happen to everybody, but that's been a common complaint that I've had from patients. Now, another side effect, which I have mentioned, and I've actually reported it to the drug companies, which is a concern of mine, is an elevation in the parathyroid hormone. Now, the parathyroid hormone is manufactured, to try to make it simple, and this may be an oversimplification, but it's manufactured in the thyroid. These drugs should not be used in anyone who has had medullary thyroid cancer. Now, there's medullary thyroid cancer and there's papillary thyroid cancer. Medullary thyroid cancer is not that common. It's usually seen in a cluster of conditions that are called multiple endocrine neoplasia. You're going to want to leave that up to your caregiver, your provider, because that's going to get a little too much detail, and you're going to probably say, oh my God, I don't even think I want to consider this drug. But the drug is a very useful tool. All right. I have seen people that have been able to lose a phenomenal amount of weight. The trick that we're kind of dealing with now is keeping it off when it's time to discontinue the drug. But that's a battle that I am fighting at each individual stage of the war. There is so much benefit to the weight reduction that people experience, whether it's 5 pounds or 50 pounds. And I've been fortunate enough not to have anybody who's had to lose 500 pounds. But I remember some of them from residency. But getting back to the use of these drugs, they are wonderful drugs, okay? They're not always covered by your insurance, and they are terribly expensive. There are options that you don't have to pay the cash price, or what you would call, I shouldn't say that, not the cash price. You don't have to pay the like $1,200 for a month's supply. That would be the list price, okay? There are options for both Wegovy and for Zepbound that you can pay cash directly from a pharmacy that is actually sponsored by the drug company. And the savings is absolutely phenomenal. Now, there are some people who actually have the disposable income that they can use in order to get these medications. And unfortunately, there are some who cannot. But that's the best program that I am aware of. If you guys want more information when you come into the office, I'm more than happy to provide it to you, all right? Because the cost is actually fairly affordable. And if you have one of those healthcare savings account, you might be able to use some of the money on that card to purchase the medication. Now, the only trick is that sometimes people will take the medication and then they will think, oh, I just won't eat and I'll lose the weight. And you will. But the trick comes when you've already lost the weight and it's time to go off the drug. That can be a little tricky. Which brings me to other medications, which you can use primarily, or you can use them after you use the GLP-1's. There's phentermine, which is kind of our old standard. It is I believe, a Schedule 3 drug. I'd have to look that up. But it is a controlled substance, and it is an amphetamine that can be used to help suppress a person's appetite. It works in the satiety center of the brain, kind of making you not want to eat all the time. Or I guess you would call it the food noise. It quiets the food noise. So when you eat, you're eating for purpose, which is the way we're supposed to eat. But we won't get into that. I think eating out of nervousness is something that is very common. Some people eat to stay awake, like when you're on call all night in the hospital, or when you're a resident. It's terrible. Anyways, there's also other medications. There's lisdexamfetamine, which is a medication that has been used for attention deficit disorder, as well as binge eating disorder. That can be very useful too. The only problem with the amphetamines is if you're having issues with your heart, or if there's a contraindication for using an amphetamine, if you are unable to sleep, because there are some people who are so exquisitely sensitive to amphetamines, it doesn't matter how early in the morning you take it, you cannot sleep. And not sleeping is, in my opinion, a form of torture, because you've got to get your sleep. Now, there's also another drug that is used for partial complex seizures. All right. It's called topiramate. It originally was called Topamax. I don't even know if they make Topamax anymore, but topiramate is the generic name. And that actually is a drug that is used for migraine headaches. It's used to help suppress your appetite because it will change how certain things like soda taste. Anything that is sweet or bubbly makes it taste almost like vinegar, and it just causes a person not to want to consume that. I remember a lady who had an issue with migraines, who lost 14 pounds almost in, I think it was 6 weeks. It was not an intentional weight loss, but she lost 14 pounds because we started her on topiramate in order to help manage her migraine headaches. Kind of made me wonder about using that one too. But my migraines had resolved by then. Another drug is orlistat, which I would say it's helpful. What it does is it interferes with your body's ability to absorb fat. And if you are eating a lot of fat, you might end up with skid marks in the underwear. I've always been one to kind of chuckle about bodily functions. I don't know why they entertain me, but they do. There is also another drug that is called bupropion. Its brand name was Wellbutrin. I don't know if Wellbutrin is made anymore, but that is an antidepressant medicine, which is also used for attention deficit disorder, because those two conditions are like intertwined. But that's another talk. But the bupropion, not buprenorphine, we had to talk about that in another video. Totally different drugs, so don't make a mistake on that one. Bupropion or Wellbutrin can also help because many times when people are depressed, they will eat more. Now, that can be used in combination with another medication called naltrexone. Naltrexone is a medication that was originally used to help treat and block the desire to use opioids. It can be used in an injectable form, and it also comes in a pill form. And you can use it for that. You can also use it to help deter the use of alcohol, because you would be surprised how much the alcohol contributes to the weight gain and the weight maintenance. Naltrexone is a good drug for that too, and it will suppress your appetite. I think what it does is it quiets the compulsion to want to put something in your mouth, quiets the compulsion of consuming food. So out of all the drugs that we've talked about, we've got the GLP-1's, all right? We also have the amphetamines, we have naltrexone, we have bupropion, we have orlistat. Now, there are different criteria that we use in order to try to obtain coverage for people who have the medical coverage through their insurance to get some of these medications. Weight management or active weight management, or some people just call it weight loss, it's all the same thing, is sometimes a carve out with certain health plans. Just because you have health insurance does not mean these medications are covered. There's a lot of conditions that go into the coverage of these medications. So there are a lot more people out there that they have insurance, but they're going to have to pay cash for these medications. Now, weight management, some of the criteria are that you need to have a BMI of 27 or more and have 2 medical problems that are induced by the weight. The weight itself can also be an issue if your BMI is over 30 for some plans or over 35 for other plans. But those are all things that are very individualized, and you want to take those into account. Now, I do have some patients that will come into the office and say, oh, I called my insurance and they said they won't cover Zepbound, but they will cover Manjaro. Can you please diagnose me with diabetes? Only if you have diabetes. If you don't have diabetes, you're not going to get diagnosed with diabetes. At least not in my office. Okay? Now, we can do blood work in order to determine if you do have a medical condition that will help you obtain coverage. But chances are, if you're already an existing patient in my practice, you've already been checked. But if you're a new patient, we can always check you. But I will tell you, you are not going to get diagnosed with any medical problems that you do not have. I think it's interesting when people ask me that. And I make sure I keep a mental note of that too. I hope you guys enjoyed this little discussion about medications used for weight loss or weight management. We can always revisit this again, but I have to admit I have to get up early tomorrow and I'm tired. So we're going to sign off. You guys have a great day. It's been fun talking to you. Bye.